So let's learn about clinical testing for brainstem death. So I have taken one table from Bailey and Love. So this explain clinical testing. We can do some clinical testing for brainstem death, mainly using transplant. Okay, so we can do by three way. The first one is cranial nerve reflexes, second is motor response, and third one is apnea test. Okay. So today we'll talk about cranial nerve reflexes and how to remember the nerve associated with reflexes. So first one is pupillary reflex. Okay. So this is our pupil, looks like O. So in cranial nerve we have only three nerves start from O. First one is olfactory, second is ophthalmic, third is oculomotor. So olfactory associated with olfaction, nothing related to pupillary reflex. So leave that one. So it is ophthalmic and oculomotor. So this is number 2 and this is number 3. So oculomotor associated with number 2 and 3 cranial nerve. Okay. So next one is corneal reflex. Okay. So corneal reflex. So now we are talking about number 2. Corneal. So total number we have 1, 2, 3, 4, 5, 6, 7. So cranial nerve 7 associated with corneal reflex, and we also have found we have 1 in this letter. So 1. So it is V1. We have division in trigeminal. So it is V1. Okay. So V1 and 7 is your corneal reflex. Okay. Next is oculocephalic. Okay. So this is also known as doll eye movements. In exam you will get doll's eye movement. So doll eye reflex. Okay. So we have 4 letter in doll, eye 3 and reflex 6. So cranial nerve 4, 3 and 6 associated with doll's eye movement. Okay, done. Next is vestibulocochlear. Vestibuloocular. Okay, so it's vestibuloocular. Vestibulo means something related to cranial nerve 8. Okay, and oculo is oculomotor, so it is 3. Okay, and just also remember 6 is also there, so 3 and 6. Okay, 3 and just double it. Okay, now cough and gag reflex. Okay, cough and gag reflex. So gag, just so cranial nerve number 9 and 10 associated with gag and cough reflex. And just remember cranial nerve 1 and 12 you cannot examine in unconscious individual. So just remember, the first and last cranial nerve you cannot examine in unconscious, first and last cranial nerve. Okay, so this much you should remember in cranial nerve reflexes. I hope it will help you. Okay, thank you.